Assalamualaikum. We are from Group 1, then Down syndrome disorder. This is our table of content, which consists of introduction to Down syndrome, causes, ocular and visual problems in children with Down syndrome, learning disabilities, and role of optometrists to manage Down syndrome children. I'm Nur Alia binti Mazainuddin, will present introduction of Down syndrome. Down syndrome is a condition in which an individual has extra copy of chromosome. Typically, a normal baby is born with 46 chromosomes, but the babies with Down syndrome have an extra copy of one of these 46 chromosomes, which is at chromosome 21. And also, Down syndrome is also known as trisomy 21. Due to the extra copy of chromosome, the function and development of body and their brains are affected. Down syndrome is the most common genetic disorder that affects learning abilities. Approximately 1 in 700 children may have Down syndrome. There are 3 types of Down syndrome, which are trisomy 21, translocation Down syndrome, and mosaic Down syndrome. These are some common physical features of Down syndrome. They have flattened face, small ears, short neck, single line palm crease, small hands and feet. They have slant up almond-shaped eyes. Their tongue tends to stick out of the mouth. They have poor muscle tone or loose joints, and they are shorter in height as children and adults.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Shamina. I'm going to continue the presentation with the causes of Down syndrome. Okay, generally, Down syndrome occurs due to the random error that happened during cell division that results in the presence of an extra copy of chromosome 21. You can see here that a patient with Down syndrome has a total of 47 chromosomes instead of 46. Okay, there are 3 genetic variations that can cause Down syndrome. First is complete trisomy 21. This is the most common form of Down syndrome. Okay, this is called complete because in each body cell, they have 1 more extra copies of chromosome, okay, making a total of 3 chromosomes. Okay, this happens due to the abnormal cell division during the development of sperm or ovum. Next is translocation trisomy 21. This is the only form of Down syndrome that can be inherited. Okay, in this case, the total number of chromosomes is still 46. However, some part of chromosome number 21 attached to other chromosome. Okay, in this picture, you can see it attached to chromosome number 14. It can also attach to chromosome number 13, 15, and 22. Okay, the least form of Down syndrome is mosaic trisomy 21. Okay, in these cases, some body cells have extra chromosome, while some do not. Mosaic refers to the combination of normal and abnormal cell caused by abnormal cell division after fertilization. Okay, as for now, no known behavioral or environmental factors such as toxin, lifestyle that can cause Down syndrome. The only known non-genetic risk factor is advanced maternal age, more than 35 years old mother. Okay, however, this is not definite because 80% of children with Down syndrome are actually born from mother younger than 35 years old. Okay, that's all from me. I'll pass to my friend to continue with the presentation. Thank you.
The visual problems that usually found in children with Down syndrome are refractive errors. They may have myopia, hyperopia, and astigmatism. Over the early years, Down syndrome children tend not to emmetropize, that is, they do not outgrow the baby errors. Next is strabismus. Most common compared to exotropia is esotropia. Then the frequency of this problem is 20% to 60%. Then the children who have screen tend to have poorer focusing than children without screen, and they may need a bifocal glasses. Strabismus also can lead to amblyopia and loss of stereopsis. Other problem is keratoconus. Keratoconus is usually diagnosed around puberty and should be monitored regularly. Blurred vision, corneal thinning, and corneal haze may result from keratoconus. Next one is cataract. There is increased incidence of congenital cataract as well as acquired cataracts. Blepharitis is inflammation of the eyelids with redness of the edge of the lids and crusting around the lashes may occur and cause a feeling of dryness and burning. This usually happens due to hygiene issues. Excessive tear occurs because the drainage channels are blocked and narrow due to the facial feature of Down syndrome children. Around 15% of Down syndrome children have nystagmus. Most children with Down syndrome have problem with accommodation. Thus, they have poor focusing They tend to under-accommodate by quite a large amount. This means that close work must be more difficult. Eyelash anomalies also occur commonly, especially in adults. Ingrowing eyelashes can cause considerably discomfort. Okay, for the ocular anomalies in children with Down syndrome, there are characteristic features about the eyes. This includes upward slanting of the eyelids ranging from 63% to 82%, prominent fold of skin between the eye and the nose, and brush field spot, which is a small white spot present on the iris, common on blue, green, or hazel iris compared to the iris. The epicanthal fold ranging from 31% to 97%. Ptosis will be seen as a lid drop. Epiblepharon is a condition in which the eyelid retains a muscle and skin right above the eyelid margin to form a horizontal fold. Here, this is the Down syndrome face. So we can see a upward slanting of the eyelids, fold of skin between the eye and the nose, ptosis, epiblepharon, brush field spots, and corneal ectasis.
Next is about the tips for examining Down syndrome children. So, the first one is appropriately identify needs during the scheduling process. Like ask the parents a simple questions. For example, does your child have any special needs that we should be aware of? The second one, ask about a time of day that the patient may cooperate best. The third one is ask parents to bring comfort items, for example, like the blanket, toy, or even a doll. Next is about give extra time for the first examination to the Down syndrome children. So it will be helpful for the children to adjust to their surrounding and to communicate at their own pace. Next, comment about how we like their shirt to help accrue the child's trust. The sixth one, showing the technique to the child's doll first before we do to them. So it will let them to know how the test is. And the last one is give patient choices during the exam to increase their interest. Tips for examining eye problems. How to examine them? Okay, firstly, appropriate vision testing by using a chart that have pictures or test that can match the symbols. The second one is dynamic retinoscopy. It is easy to examine when they have a focusing problem, for example, like accommodative lag. The third one, psychoplegic refraction. So it is enable the optometrist to obtain an accurate optical prescription. The second one, it is easier to examine the back of the eye. The last one is be able printed materials and images. So it is help them to succeed to see the things.
Bismillahirrahmanirrahim. My name is Dorshaniza and we will proceed to the learning disabilities. Okay, firstly, children with Down syndrome is actually learn and progress more slowly compared to most other normal children. However, not all areas of development are equally affected. Okay, there is a specific pattern of cognitive and behavioral features that are observed among children with Down syndrome that differ from that seen typically in developing children. Okay, next we will proceed to see what is the learning disabilities in children with Down syndrome. Firstly is the motor development, number skills, expressive language, grammar and speech clarity, and lastly verbal short-term memory. Okay, firstly we will go to the motor development. Motor skills develop at a slower rate for children with Down syndrome. These delays in motor development reduce infants' opportunities for exploring and learning, therefore further affect the cognitive development. Poor oral motor control may impact the development of language skills also. Next, we will go to the expressive language, grammar, and speech clarity. Almost every child will have expressive language that is delayed relative to their language comprehension. The children experience two types of expressive difficulty, which is delay in mastering sentence structure and grammar, and specific difficulties in developing clear speech production. The gap between the children's understanding and the ability to express themselves is a cause of much frustration and can sometimes lead to behavior problems. It can also result in children's cognitive abilities being underestimated. Next, we will proceed to the number skills. Most children with Down syndrome struggle with basic number skills, and their number skills are typically some 2 years behind their reading skills. Verbal short-term memory. Short-term memory is the immediate memory system which holds information in mind for a short period of time and supports all learning cognitive activity. It has separate components specialized for processing visual or verbal information. The ability of children with Down syndrome to hold and process verbal information is not as good as their ability to hold and process visual information. These verbal short-term memory problems make it more difficult to learn new words and sentences. They also make it more difficult to process spoken language, and this can adversely affect their learning in the classroom. Studies suggest that the process and recall of spoken information is improved when it is supported by relevant picture material. Thus, educators are stressing on the importance of using visual support, such as pictures, sign, and also print when teaching children with Down syndrome, as this approach makes a full use of their stronger visual memory skills. Okay, so that's all from me, and we will proceed to Nurul Hana for the role of optometrist. Thank you.
Thank you, Shaniza. Assalamualaikum and hi, my name is Johanna and I'm going to explain the role of optometrist in managing Down syndrome patients. So first, the most important thing is to grab patient attention. To attract children, we must set up the examination room to be child-friendly. For example, we can provide room with toys, books, miniature table and chairs. This will create a fun, playful and non-threatening environment and make them feel more comfortable. Other than that, we can also draw the patient to the task so that they will be more attracted to us. Once you get their attention, you can proceed to other tasks and activities. Next, to conquer the examination, the keys are to be observant, be quick, be flexible and be fun. Use creativity to modify the task and be sensitive to the child's need. This is important to keep their attention during the test. When examining Down syndrome patient, try to avoid pauses during examination. Pauses in exam are an opportunity for them to make trouble and lose attention. Keep them busy. Don't make yourself get stuck or allow them to frustrate you. The next point is to be quiet, use few words and employ gesture. Don't talk too much. This is because noise is distracting and irritating and will make them feel uncomfortable. Quietness will facilitate attention. Besides, many children have hearing problem and their auditory processing is low, so you will need to speak a little more slowly than usual and in shorter sentences. Give them longer time to respond to your questions or instruction. Use gesture when communicate with them. Child with Down syndrome are more familiar and responsive to body language, such as pointing, thumbs up or thumbs down. For example, you can snap finger to get eye contact. The last point is to keep calm and don't be offended. As an optometrist, self-control is important. We must maintain a calm demeanor even when the patient is upset. Understand that as defensive measure, patient may lash out due to feelings of insecurity. The child may be trying to provoke you. What you have to do is just ignore obnoxious statement and stay on task. So this is the example of role of optometrist that I have explained before. Use gesture communication, be flexible, maintain calm demeanor. So I think that's all from us. Thank you.